Common triggers of post-traumatic stress disorder, PTSD, and how to avoid them. Post-traumatic stress disorder, PTSD, is a mental health condition that develops after someone has experienced or witnessed a traumatic event. Individuals with PTSD often experience intense, persistent symptoms that can interfere with their daily lives, such as flashbacks, nightmares, and hyperarousal. One of the challenges of living with PTSD is managing triggers, specific situations, sights, sounds, or experiences that evoke intense memories of the trauma and worsen the symptoms. These triggers can lead to distressing emotional and physical reactions. In this article, we will explore some common triggers of PTSD and provide strategies for how to avoid or manage them effectively. Understanding these triggers can help individuals with PTSD reduce the frequency and severity of symptoms and improve their quality of life. 1. Sensory triggers, sounds, smells, and sights. Sensory stimuli, such as certain sounds, smells, or visual cues, can serve as powerful reminders of the traumatic event, causing an individual to relive the trauma in vivid detail. Common sensory triggers. Sounds, loud noises, such as fireworks, sirens, or even traffic sounds, can trigger flashbacks, especially for individuals who have experienced combat or violence. Smells, certain scents, such as the smell of smoke, gasoline, or a specific perfume, may evoke memories of the traumatic event, causing anxiety or distress. Sights, visual triggers, such as images of accidents, violence, or even specific places, can bring the trauma to the forefront of the mind. For example, individuals who have experienced a natural disaster may feel triggered by weather patterns that resemble the event. How to avoid sensory triggers. Identify specific triggers. Take note of any sensory stimuli that provoke strong emotional reactions. Keeping a journal can help identify patterns and specific triggers to avoid or manage. Control the environment. Create a safe and calm space by eliminating known sensory triggers, such as noise or specific smells, whenever possible. Use earplugs or noise-canceling headphones to minimize exposure to loud sounds. Grounding techniques. Use grounding techniques, for example, deep breathing, 5-4-3-2-1 technique, when you encounter a triggering sensation to refocus on the present moment and reduce the intensity of the reaction. Key insight. Sensory triggers, such as sounds, smells, and sights, can bring the trauma back into the present moment. Being aware of these triggers and using techniques to ground yourself can help minimize their impact. 2. Situational triggers, reminders of the trauma. Certain situations or events can serve as a reminder of the trauma, particularly if they resemble aspects of the original traumatic event. This can cause intense emotional distress and anxiety. Common situational triggers. Anniversaries. The anniversary of the traumatic event can be a highly triggering time, leading to intense emotions and flashbacks. Certain locations, being in places that are connected to the trauma, such as the site of an accident, a hospital, or a former abuser's home, can trigger memories and emotions. Conflict or loud arguments. Individuals who have experienced domestic violence or combat may be triggered by conflict or confrontations, even if they are unrelated to the trauma. How to avoid situational triggers. Anticipate difficult times, prepare for anniversaries, certain dates, or upcoming events that might trigger the trauma. Use coping strategies, such as self-care, therapy, or support from loved ones, to help manage the emotional intensity during these times. Avoid triggering places. If possible, avoid locations that are directly associated with the trauma. If avoidance is not possible, prepare yourself mentally for exposure and have a coping plan in place, for example, breathing exercises or a safe person to talk to afterward. Set boundaries. In situations of conflict or arguments, make it clear to others if you need to step away to regain emotional stability. Setting healthy boundaries is essential for protecting your mental health. Key insight. Situational triggers often bring a flood of emotions and memories. Being proactive and setting healthy boundaries can help manage these situations effectively. 3. Emotional triggers, stress, anger, and anxiety. Intense emotions, such as stress, anger, or anxiety, can trigger a PTSD response, especially if these feelings mimic the emotional intensity of the original trauma. Common emotional triggers. High-stress situations, work pressure, financial problems, or family conflicts can trigger PTSD symptoms if the stress mimics the overwhelming feelings experienced during the trauma. Anger or irritability. Individuals with PTSD may become more easily angered or irritated, especially in situations that feel out of their control, which can trigger a fight or flight response. Anxiety. Elevated levels of anxiety, particularly in crowded or unfamiliar settings, can evoke feelings of vulnerability or helplessness, similar to how the individual felt during the traumatic event. How to avoid emotional triggers. Practice stress management. Engage in stress-relieving activities such as yoga, meditation, or deep breathing exercises. Finding ways to manage stress can help prevent it from escalating into a PTSD response. Build emotional resilience. Engage in therapy, such as cognitive behavioral therapy, CBT, to build healthier coping strategies and manage anger and anxiety effectively. Develop a coping plan. When feeling anxious or triggered, have a set coping mechanism ready, such as taking a break, speaking with a therapist, or using grounding techniques to regain emotional control. Key insight. Emotional triggers, including stress, anger, and anxiety, can cause PTSD symptoms to resurface. Practicing stress management and having coping strategies in place can help mitigate their impact. 4. Social triggers, interactions with others. For many people with PTSD, interactions with others, especially those who do not understand the condition, can trigger emotional distress. These triggers may arise from misunderstandings, judgment, or social anxiety. Common social triggers. Conversations about trauma. Talking about the traumatic event with others or hearing someone else's traumatic story can bring up painful memories. Unfamiliar or unsafe social situations. Being in crowded places, at parties, or in unfamiliar environments may cause anxiety and lead to a feeling of being unsafe, reminiscent of the trauma. Judgment or lack of understanding. Well-meaning comments from others, such as "just get over it," or "it's all in your head," can invalidate the trauma and deepen feelings of isolation and shame. How to avoid social triggers. Communicate with loved ones. Be open with family and friends about your triggers and needs. Let them know what helps and what makes you feel unsafe or overwhelmed. Practice self-compassion. Remind yourself that it's okay to set boundaries in social situations. You don't need to explain your PTSD to anyone unless you feel comfortable doing so. Limit exposure to triggering social events. If certain social situations or people trigger emotional distress, it may be best to avoid these interactions or set clear limits. Plan your social outings in advance and give yourself permission to leave if you start feeling triggered. Key insight. Social triggers, including misunderstandings or uncomfortable social environments, can increase PTSD symptoms. Open communication and setting boundaries are key to reducing social stress. 5. Physical triggers, trauma-related physical sensations. For some individuals with PTSD, physical sensations related to the traumatic event, such as pain, tension, or discomfort, can trigger memories of the trauma. Common physical triggers. Loud noises. Sudden, loud noises, such as fireworks, alarms, or sirens, can trigger flashbacks and a strong emotional response. Physical sensations of danger. Feeling trapped or unable to escape a situation can mimic the feelings of helplessness experienced during the trauma, causing physical and emotional distress. Physical discomfort or pain. Physical injuries or discomfort can act as a trigger if they are similar to the trauma-related sensations, bringing back feelings of vulnerability or fear. How to avoid physical triggers. Prepare for loud environments. If you know you'll be in an environment with potential noise triggers, consider using earplugs, headphones, or sound masking apps to reduce the impact of sudden sounds. Recognize body signals. Pay attention to physical sensations, such as tightness in your chest or increased heart rate, that may signal distress. Use breathing exercises or progressive muscle relaxation to reduce tension and regain control. Create a safe space. Make sure you have a place where you can relax, unwind, and feel secure, especially during moments of physical discomfort or pain. Key insight. Physical triggers, including loud noises and bodily sensations, can re-evoke trauma memories. Recognizing and addressing these physical sensations with relaxation techniques can help reduce their impact. Conclusion. Post-traumatic stress disorder, PTSD, is a complex condition that can be triggered by a wide range of stimuli, including sensory, situational, emotional, social, and physical triggers. Understanding these triggers and implementing strategies to manage or avoid them can help reduce the frequency and severity of PTSD symptoms. By using coping techniques, creating supportive environments, and seeking professional help, individuals with PTSD can better manage their condition and improve their quality of life.